Succes i veterinær praksis, podcast nummer 99. Det er meget tæt på 100. Velkommen til. Dyrlæge Søren Pejstrup her. Jeg er rigtig glad i dag, både fordi, at det er meget tæt på den her jubilæumsepisode nummer 100, og så fordi, at vi skal snakke om et emne, som jeg ved, der interesserer rigtig mange af jer. Vi skal nemlig snakke om allergipatienter og hudpatienter, og nærmere bestemt om immunterapi, eller mere sådan ret dansk, allergivaccinen. Da en gang jeg startede podcasten for nogle år siden efterhånden, der tænkte jeg, nu prøver jeg lige at lave 20 episoder, så ser vi, hvor det fører hen, om der er nogen, der overhovedet interesserer sig for det, om der er overhovedet nogen, der har lyst til at lytte til dem. Og nu, lige pludselig, så er vi nået til 100 episoder. Og det er kun fordi, at I er så søde derude, jer der lytter med, og bliver ved med at lytte med, og jeg kan se, at I bliver ved med at downloade episoderne, og jeg får nogle rigtig søde mails fra jer også, og jeg ved, at flere af jer også har skrevet mails og beskeder til dem, jeg interviewer her i podcasten. Både af dyrlægerne og dem, der kommer til fra andre brancher end vores, der alle sammen hjælper os med at blive klogere og måske på et lille felt i vores hverdag, men ikke desto mindre en lille smule klogere. Og de søde ord, I sender både til mig og til dem, det betyder rigtig meget, og det er faktisk også grund til, at det bliver ved med at være sjovt at lave de her podcast. Det skal I hvert fald have mange tak for, og jeg håber meget, at I bliver ved og synes, at det bliver ved med at være sjovt at lytte til podcasten. Så længe at I synes det, så fortsætter vi, og jeg har allerede de næste podcast på den anden side af 100 planlagt. Jeg har noget lidt særligt planlagt for den næste, altså nummer 100, men det tager vi på næste søndag. I dag har jeg fået en rigtig dygtig ekspert på krogen. Mange af jer kender hende, især hvis I interesserer jer en lille smule for hud. Hun hedder Babette Baddaky Taugbøl, og vi skal snakke om immunterapi, og det er et af de emner, som hun beskæftiger sig rigtig meget med. Hun får lov til selvfølgelig, ligesom alle andre, at give en kort introduktion til sig selv, så vi kan lige så godt springe ud i det. Husk, at der som altid er links og noter til dagens afsnit. De er på SIVP.dk/99, SIVP.dk/99. Og så over til interviewet. Hello, Babette, and welcome to the podcast.
Thank you very much.
You're a quite well-known person in our industry here in the Norwegian, or the Nordic countries anyways. But can you please give us an introduction to who you are for those who don't know you?
Yeah, sure. My name is Babette Baddaky Taugbøl. I'm actually a German, studied in Hanover, and have lived in Norway for the last nearly 30 years. So I'm a veterinarian, and I work in the field of dermatology, which means skin disease, and my special interest is in allergic disease and treating animals with allergies. And I've done my English specialization certificate in the UK, and I'm also a Swedish recognized specialist for skin disease and dogs and cats, and I work in the clinic, and I also work as a consultant for veterinarians all over Scandinavia. They can phone the company and get advice on their allergy patients and how to treat better, how to adjust treatments, and I also lecture in the Nordics. Yeah, well, that's probably basically what I do.
But you have been quite a lot of places and do a lot of do a lot of stuff. It sounds like.
Yeah, I do. I really enjoy it because it's such a variable job. I work from the office and then I see patients. Like yesterday, I was at the clinic and I had cases with allergies and ear problems. So I can have hands-on effect of the products that we are selling, how the immunotherapies work, and I think it's really good that you can see the patient that you are treating, so that you can not only tell other veterinarians how to approach the cases, but that you really have your own cases that you can refer to.
Mm-hmm. And for a vet like me that works in general practice, I see quite a lot of dermatology cases, even if I like them or not. We do have quite a lot of cases in Denmark anyway, and I believe that to be true in most countries. But they're sort of frustrating. So some of the frustration comes because I don't know enough about them, and the other frustration comes because I'm lacking some kind of overview or lacking a specific test that tells me what to do. So maybe you can try to open the box a little for us here and give us an overview on what we should do and where we go wrong.
Yeah, exactly. I think that's a very good point. And I teach practitioners that are not specialists. So I know exactly where you are, and I've been there myself. And the thing is that we see a lot of dermatological patients in our practice. They come in with itch, they come in with ear disease that is always recurring. After we put some eardrops down there, they go better, and then they come back. And we forget to think about the cause behind the skin problems and the ear problems. About 20% of the skin cases that come into the clinic have allergy as an underlying problem. So for the vet, there's not just one single test that they can do to get the diagnosis of allergy, because this is something that many vets and also many owners think that they can just take a blood sample or can just do a skin test and they will have the answer. Unfortunately, it's not as easy as that. But on the other hand, if you have a good plan in your practice, it's actually, we only cook with water, the dermatologists, so we don't have any fantastic tools either. So what you do is you do a good history of the case. You look at the patient. We know that some breeds are more predisposed to allergies than others, and there are lists of those breeds in the books. And then you start your normal workup. So you always start by eliminating ectoparasites. So things like Sarcoptes, lice, fleas have to be eliminated first because they are a very common cause of pruritus in our animals. And you have to look for them. And if you can't find them, it's fine to treat for parasites. And the next thing is that you look for infections. In the case of ears, you often see infections with yeasts, Malassezia, for example, or cocci. And the same is true on the skin. If you have crusts or small little pustules, you should take samples from these and you should make what we call cytology. I know you also have webinars on that, Søren, and people can go there and have a look because doing cytology is actually very easy. All you need is a Diffquick or a hemacolor, which is a staining that you can use in your practice, and you press the slide onto the lesion, or you take the swab from the ear and put it on the tray, and then you color it, and you look in the microscope, and you will easily recognize cocci-formed bacteria or rod-formed bacteria or yeasts, which are usually then Malassezia. And when you see this, and you see, obviously, if you see it, you see lots of it, then you should treat for that. And then take the patient back after you've treated for the infections and see how much of the pruritus that was there initially is left. And then if there is still pruritus left after you've treated for parasites and infections, then you should do a food trial, because food allergy can also lead to pruritus and ear disease and other skin problems. And there is not an easy test to just take a blood sample and see if the dog is allergic to food, because these kind of food allergy tests that are sold by laboratories, they only tell you what the dog has met, also what the cat has been exposed to. What these tests do is they measure allergen-specific IgE and IgG. And if you have, for example, very high numbers for chicken, this means that the animal has eaten chicken. It does not mean that the animal is allergic to chicken. So if you want to use this test, then you should go for the proteins on the test result that have very low numbers and do your elimination diet with those ingredients. That will give you a much higher chance to find a diet that the animal will not be allergic to. And then you do this diet for 8 weeks. And during that time, it's important to follow up the owner, call them after a week, call them again after a month, maybe get them in for a recheck to really make the owner go ahead and do the diet properly. During this diet, obviously, it's important to treat the animal for itch, and during the first 5-6 weeks, so you can use nearly any kind of antipyretic medication. But during the last 2 weeks, you should not give any antipyretic medication, because then you want to know if it's the diet that is responsible for the drop of the itch, or if it was just the medications that you were giving. And after 8 weeks, you then do what I call here in our Scandinavian languages, I call it julebord, which means you give them any kind of food that you would like to give to the dog. So it's a Christmas buffet. So they are allowed to give the old dog food, they give the treats, they give the toothpaste, they give cakes or whatever they want to give to the dog. And then during the first week, up to 10 days, the owner observes if the pruritus comes back. If it comes back, then it's probably due to something in the food. And then it's up to the veterinarian and the owner decide how they want to proceed. Either you go back to the diet that you had been given to the dog, where the dog was fine. Some owners just prefer to stick to that diet. And others want to really find out what my dog or my cat cannot eat. And then you take your basic elimination diet, whether the animal was fine, and you add one protein at a time, which means you add, for example, chicken for some days and see if that gives any symptoms. If it does, you put chicken on your list of ingredients that your animal should never have. Then you can take the next one. You can take pork, you could take cheese, depending on what you would like to feed the animal. Mm-hmm. And by that process, you will be able to find out what your animal can tolerate. And most food allergic animals, they react to 2 to 3 ingredients. So it's not only one thing, it's usually more than one thing that they cannot tolerate. And this food elimination is really, really important in the process of making the diagnosis of the last part of the allergy, which is the atopic dermatitis. Because once you have eliminated parasites, infections, and the influence of food, then you are left with pruritus, which is due to what we then call atopic dermatitis. And atopic dermatitis is an allergy to things in the environment, like pollens, like house dust mites, storage mites, maybe some molds and things.
Yeah.
And then you've made your diagnosis.
So I have a couple of questions I'll go back to in just a couple of seconds, but it sounds like it's more like a clinical diagnosis than a paraclinical diagnosis.
Exactly. You're absolutely right. Atopy is always a clinical diagnosis. You cannot make the diagnosis just by taking a blood sample or doing an intradermal test. Just think about, you are faced with a dog that actually has, let's say, lice, which may be easy to see, but it can also have scabies. And scabies gives quite a lot of pruritus. If you would take a blood sample of the dog with scabies, it will come back and show really high reactivity against house dust mites and storage mites. And that's because there's a cross reaction between the scabies mite and the house dust mites. So you will sit there with the paper telling you the dog has really, really high IgE towards mites, which is what he has. But then you can easily misinterpret this, make a diagnosis of allergic disease, and in fact the dog has scabies. And this has happened. So this is why it's so important that we have to make the workup and we have to do the diagnosis on a clinical basis.
And it sounds like you have an already made plan, 1, 2, 3. Like you go through this with basically every patient, parasites, infection, food trial, and then the atopy diagnosis.
Exactly. Yeah, and with all pruritic cases, be they dogs or cats, I do exactly this. And it's not so difficult. It's 3 things you have to eliminate before you make the diagnosis of atopic dermatitis. This can be, in some cases, it can be a challenge to do the food trial properly, but this is always the thing I try to do. And with some animals or some owners, food trials are impossible. And then, okay, we think, right, we will go for the next step and we will we think that the dog probably has mostly atopic disease and maybe not so much food, and then we proceed with the testing after that.
Yeah. And you have already explained some of this with the scabies mites, but when this sounds very good. And when we are talking to real people and are faced with real patients, sometimes the reality is a little more difficult. And then we have a patient that we get the ear infection somewhat under control, and then the owner sort of forget about it, and then 3 months later it comes back, and the owner is irritated because it wasn't treated probably the first time, and now it's back, and now they want something else or something stronger, and maybe they want the money back, and then we start to talk about the food trial, and maybe it's because of my communication skills, I don't know, but some people start to get pale when I talk about 10 weeks or maybe even 4 months on a special diet that is not inexpensive as well. And then they come back and tell me, yeah, I read something in a Facebook group about this blood test. So can we please just take the blood sample and get it done with? And you have explained why that is not good, but can we maybe talk a little bit more about it? Because I know vets I talk to, and I certainly have fallen into that trap of, okay, let's just run the test and see what comes out.
Yeah, I mean, you can, in a way, you can do that. This would mean that you would start with making your diagnosis of allergic disease based on elimination of infections and parasites. You have not done the food trial. I would then, at that time, explain to the owner that allergy in our Scandinavian countries usually is due to either food and or the other form of allergy, which is the mites and the pollens. And in fact, up to 50% of our patients, they have both. So if we are faced with a dog that is 2 or 3 years old and it will live for another 10 years, I tell them that if we are not doing or not trying to do the food trial, or not trying to at least put the dog on one diet and stop all the treats that we're giving, we may end up in a situation where we have to give this dog quite strong medications to kind of give them something against the strong pruritus that they get. And we know from studies that if you want to treat food allergy with drugs, then you need really a lot of drugs, and you will get lots of side effects. And obviously an immunotherapy, which we use for house dust mite allergies and pollen allergies, an immunotherapy will not work for food allergy. So, and in many cases, I managed to convince the owners that it is a good idea, and then especially in young animals, to do this food trial in order to be able to relieve the patient from unnecessary medication. If they really don't want to do it, then I go ahead and say, yes, let's then say that we have a diagnosis of allergic disease and you don't want to do anything with the food. Then we will do the test, and the so-called allergy test, or actually IgE test. You can do it either by serology, which means taking a blood sample and send this to a good lab that uses a valuable test that is well documented. Or you can do a so-called intradermal skin test. Not many veterinarians do that anymore. There are only some dermatology specialists that do intradermal tests. The result of both is comparable, so you don't have to do an intradermal test. You can also do a good blood test. The blood test comes back, and then it is very important to do a good interpretation. And to be able to do a good interpretation, you have to have some knowledge. If you as a veterinarian feel that you do not have that, then I think you should talk to your laboratory. And in our company, Dr. Baddaky, we have dermatologists that you can consult with every morning, 9 to 12. You can phone and you can talk to a dermatologist who has long experience in interpreting these tests according to your patient and the history of the patient. In Denmark, you have the lab by Christian Petersen, Vet Allergy. He also gives that service. Mm-hmm. So I think it's important to talk to your lab if you're not really very familiar of how to interpret. And then you decide on the basis of the history and the result which allergens to either try to avoid contact with or to include in immunotherapy. Let's say, for example, you have a German Shepherd dog with pruritus that is the same all year round. And the result comes back and it says there is a high IgE activity against the mites, which is what we see quite often. And there's also a high IgE activity against some of the grass pollens. In this case, I would go back to the owner and say, are you sure that your dog does not get worse during June, July? And if the owner says, no, I don't really see any worsening in the summer, it's actually the same. It may be a little bit worse in the spring and a little bit worse in the autumn. That is very typical for house dust mite and storage mite allergies, because during the spring and the autumn, we see more reactions to these mites. It gets humid, it gets around 20 degrees. That's what mites really like. So in this case, I would say, all right, we have a result which tells us here are pollens and here are mites, but the history of this dog does not fit with pollen allergy, so we will only take the mites. We will include the mites and prepare what we call an allergen-specific immunotherapy based on that result.
Mm-hmm. And we're going to talk more about that as well. I just have a couple of questions about the food trial or the elimination trial
yes.
As well, because I'm a little, not to open up the complete discussion about grain-free food, because this will take the rest of the podcast just to talk about that and maybe even more. But I find that some people have tried a couple of different diets. They tried something off the shelf from a food store, and then they tried the more expensive one I sell in the clinic, and then they found something that is grain-free and free of I don't know what, and they sort of see a result, but not completely. The pruritus is not completely gone, but they see some benefit of this grain-free diet. So how would you approach a case like that? Would you still do elimination diet for 10 weeks on a patient that is somewhat better on a different diet?
Yes, I think I would try to convince the owner to. So let's see if they have done a diet trial on a hopefully good diet that only contains one source of protein and maybe one source of carbohydrates, because the problem with these diets that you buy over the counter is that they can be contaminated with other things. There are diets out there where it says lamb and rice, which means by declaration that it has to include a minimum of 15% protein coming from lamb, and the rest they can put whatever protein they want in there. And this is what makes it so difficult for the owners to choose the correct diet. And this is where veterinarians come in, and they should try to explain that we don't sell these diets just to make money, but we also sell them because we can guarantee that these food allergy diets that are produced, and we have different types of these, which is really nice that we have so many things to choose from. These diets, they guarantee us the ingredients, and it's the same every time. Some of the diets are so-called hydrolyzed diets, which means that the proteins are split up into very, very small amino acids, which the immune system of the body will not be able to recognize. So in those cases, that can help. And then if the owner says that after this or the other diet, I actually did see an improvement, this is a really, really good information, because it tells me that, yes, there is something in the food the dog reacts to. And I talk to owners nearly every day, and usually when we enter this discussion about the diets, they tell me, you know what? I have noticed that whenever I give my dog chicken, I think the pruritus gets worse. And these observations, which the owners make, and many owners are really, really looking after their animals very well, and they observe this, this is very valuable information. An allergy to chicken is very common because chicken protein is in so many diets. Many dogs and cats eat chicken on a regular basis. And you get allergic to the things that you eat all the time. You don't get allergic to something that is completely new. So I think the communication with the owner is really important. What we have done in our practice and with Dr. Baddaky, we have made handouts that explain why and how elimination diets are used. You can also involve your nurses, veterinary nurses. They are usually much more patient than the vet is. They have more time to explain to the owner, and also the owner will often open up much better to the nurse than they do when they're with us. When they're with us, they're a little bit more tight. They get a little bit, we give them so much information which they can't digest, and they forget 80% of it the minute they walk out of the door. So giving good information, involving your nurse. I always tell my veterinarians and the nurses when I teach that when you decide to start an elimination diet, you and the owner decide which diet you're going to use. And then the nurse phones the owner after 1 week. After 1 week, the nurse will call and say, "Hello, Mr. So-and-so. So how is it going with your diet?" And unfortunately, in 60% of the cases, the owner hasn't even started to give the dog or the cat the food because, I had to be on holiday first, the mama was looking after the dog or whatever. So getting the owner started and then doing a good follow-up is really important with these diets. And then in many cases, this works. And what you were saying is that, yes, you have a kind of reduction in the pruritus, but the pruritus does not go away completely. This is very typical because when we look at the statistics, only about 5 to 10% of our allergy patients have only food allergy. So 5 to 10% will get 100% better on the diet. The rest of the allergy patients, they have either concurrent food allergy and atopic dermatitis. And the statistics here are variable, but up to 50% of the patients have both. And then the rest of the patients, they have only atopic dermatitis, and there is no influence of the food whatsoever. So this overlap is also very important to kind of confer to the owner that this exists. We don't have boxes in our practice. We can't just always put the dog or the cat into one box. Many things are concurrent. And the same we see with when the dog first is controlled or the cat is controlled, and suddenly they get a flare-up, like an otitis coming back, then it's usually a flare-up because they get a secondary infection with either yeast or bacteria. And then we have to treat that to get that under control again. And this is very normal with allergic animals.
So let's assume that we have control over the parasites, and I might maybe even try to treat it just to be safe. Yes. There's no more infections, and we've done the food trial with not a satisfactory result. Maybe we've seen some effect, but not enough. And then we've done the allergy testing, right? That would be the next step. And then it come back with some kind of result. Even it can be dust mites, so it can be weeds or grass or pollen, or I don't know. I don't know all the English words for the different things. So then what?
And then what? Yeah, then as I said, then you go back to the history of the dog. You talk to the owner or the cat, and you see how the test result fits the patient history. And then you choose, on the basis of all that, you choose which allergens you want to put into the immunotherapy. Maybe there are some allergens that you can avoid, or where the season is very short. Like, for example, if you have a reaction to hazel. Hazel is already pollinating in February, March, but it's a very short pollination time. We're talking about 2, maybe maximum 3 weeks. And so hazel is not really something that's going to bother that animal for a very long time. So I would not include that into an immunotherapy. If you have grasses, many of the grass pollens are from similar families, so they have cross reactions. So then I would choose maybe one or two of the grasses, maybe a weed if the dog also or the cat shows symptoms during the summertime. Grass season is very long; it can be up to 2, maybe even 3 months. So if the animal has a problem during the summer, then we would include those allergens. Basically, usually the mites usually go into the extract, into the immunotherapy in nearly all cases, because they are usually a problem in our Scandinavian countries. And then it's a little bit up to the producer of the immunotherapy of how many allergens you can include. I mean, it's not always that the more you put in, the better it gets, because the more you put in, the more diluted each allergen will be. So the producers that we work with, they usually say maximum 8 allergens per bottle of immunotherapy. So we would choose then up to 8 allergens if this goes well with the history, and then send the order for that. And it will take maybe 2 or 3 weeks to get the allergy vaccine. People usually refer it as to an allergy shot or an allergy vaccine before you get that back. And then you can start the immunotherapy, which is the best long-term treatment of the allergic patient because it addresses the root cause of the disease. But obviously, at the same time, we have to do something for this itchy dog or cat, because the itch is still there because the allergy has not yet been treated. So we would then prescribe some kind of antipyretic medication. The immunotherapy can be given in adjunct with most of the antipyretic medications that we have. And now we have actually 4 or 5 different options to choose from. And it will depend a little bit on the case, what we should choose. And then we start the immunotherapy together with the antipyretic medication. And after a certain time, usually after maybe 2 or 3 months, we will then try to reduce the medication and just after a while just continue with the immunotherapy.
And how is the immunotherapy then given?
The immunotherapy can be given either, as I said, as a shot, as an injection, and this is then will be given for the first injections usually at the clinic. And then it's up to the owner and the veterinarian to decide if the owner wants to do the injections at home. It's always the veterinarian's responsibility if they want to give injections so that the owner can do that at home. The owner can also choose to have what we call oral immunotherapy, and for humans they call it sublingual immunotherapy. These are drops that are given twice a day into the mouth of the animal, so that you have to give the drops morning and evening, and the animal should not eat immediately after that, so that the medication can have some time to be absorbed by the mouth. The injections are given with small amounts and short intervals in the beginning, and usually we end up giving 1 injection per month as a long-term treatment. And in some patients, maybe 2 injections per month. But for the oral form, you're always giving drops morning and evening.
And do you have a preferred strategy, or is that patient-specific?
No, I think it's owner-specific, because the owners will usually tell me immediately when I explain them the 2 options, which one they want. Because there are dogs that even for their annual vaccination, the dog gets really, really scared, and the owner is also scared of injections. So then for those owners, it's not an option with injections. If the owner is a nurse or very used to having needles around the house, then they usually say, but this is fine, I can do this, I have control of my dog, he doesn't mind to have this little stick under the skin. And they prefer that because it's easy to just give once a month. But as I say, the owner usually knows exactly what they would like. And And if we look at the efficacy of both treatments, they are about the same. There's one US study that shows that the oral form of immunotherapy can actually act a little bit faster, so that you can see results already after 2 or 3 months with the oral form. The injectable can take a little longer. Usually we see effect after 5 to 7 months, but it could take up to 1 year before we see an effect.
I sort of lost my train of thought.
So how long should we continue maybe with immunotherapy? That's always that was it. Yeah, I thought so. So how long should we continue with the immunotherapy?
Yes.
Well, from the humans, we know that we do the same with patients with asthma and atopic dermatitis allergies in humans, basically with asthma. We have to continue for at least 4 or 5 years to have a good effect. And then in humans, usually they stop. In animals, at the moment, we don't have any really excellent studies, but there are studies which are going to be published soon. And I've talked to some of these veterinarians that run these studies, and they say it looks like that also in animals, you may be able to stop the injections or the sublingual immunotherapy after 4 to 5 years. But it's very important to inform the owners that this allergen-specific immunotherapy is not just a treatment for one bottle or for 1 year. It is a long-term treatment, and because it takes time to have the influence on the immune system, so that the immune system after some years will not recognize the mite allergen or the pollen allergen as something dangerous, because this is what the immune system does. It thinks that these house dust mites are suddenly dangerous, and they start to react to them with an allergic reaction. So that takes time. And people always then ask me, well, what is the effect of immunotherapy? How many % of the patients really do get better?
Yeah.
And there's a new study out there now for dogs with more than 700 dogs, retrospective study from Italy, a very interesting one. And in that study, they used the injectable form, and 28% of the dogs had excellent results, which means that they could stop with any other treatment. They just gave the shots, and that was it. And the dogs were really doing well. In that study, they also saw that the dogs that had been continued for some years and then stopped, 25% of them were absolutely cured, so they did not need to continue with anything. In that study, 28% of the dogs had good effect, which means that they have to apply maybe some topical products, maybe some ear cleaners, maybe put some steroid cream on the paws or something like that. So in a total of 56% of these dogs, they saw really good results, good or excellent results. 23% in that study had mild effect, and only 20% had no effect of the immunotherapy. I think this is really something that we need to get out to our veterinary colleagues, because if you only do one immunotherapy a year and that fails, so this could be just the one that is the 20% of the failures, then you will get very disillusioned. But if you're doing a lot of immunotherapy, you would see how many patients, in fact, will have really, really good results and will need much less drugs, because everything else that we're giving as antipyretic medication are drugs that can have some kind of really serious side effects in some patients.
Yeah. I have maybe a more personal question, and you sort of talked about this already, but do you think that why should we even bother with this immunotherapy when we have these wonderful new drugs that can actually stop the pruritus or maybe even take away all the symptoms of the allergy and do all this stuff with immunotherapy?
Yeah, that's because the new drugs will not take away all the symptoms. if you want to have one drug that takes away all the symptoms, the best drug you can use there is corticosteroids. In 98% of the cases, the dog will not itch, but you will have lots and lots of side effects, and the dog will probably have a shorter life expectancy. And when you talk about steroids to owners, many owners will say they don't want steroids because they have tried them and they see that animals get lots of side effects. They drink a lot, they put on weight, they get terrible skin, etc., etc. You have the more modern drugs that can be given as either tablets or injections, which are against things in the body that are called interleukins. Mm-hmm. The interleukins are inflammatory mediators and itch mediators, so you are addressing only one part of the body's response for itch. Basically, what you're doing is you're giving something that takes away the itch. What we have seen is, yes, this can work, and it all depends on the case. I mean, if the case has very mild symptoms and not very chronic ear or pore disease, then this injection or the drug that takes away the itch can work for some time. In some cases, or in many cases, the efficacy of the drug is reduced after a while and the itch will come back. And we have also seen cases where the owner is giving the drug, the animal is not itchy anymore, but the animal then develops either ear infection or skin infection, and the owner does not notice because the animal is not itchy. So we've seen animals come in with really bad infections in the ears and skin, but because they don't itch, it takes a long time before the owner notices it. And all these drugs that we're talking about here are lifelong treatments. An allergy is a lifelong disease, and I don't know if I would want to give my dog pills or injections for the rest of the life of the animal. The only alternative that we have is to do something that remodulates the animal's immune response towards a more natural immune response where it does not overreact to these normal allergens. And this can give cure, and this can also, if it does not give complete cure, it will absolutely surely lead to that you can use less of these antipyretic medications that you would otherwise have to give much more of.
So it really basically comes down to whether you would like to treat the disease or treat the symptoms. Exactly.
And that's also a question of money, because these new drugs, they are not cheap. And immunotherapy, if it in these animals where it works, the money that you have to invest for 1 year is much less than the money that you'd have to invest for these modern either injections or tablets, which you have to give either every day or every month. They are much more expensive.
So I know we have to round off soon, and I'd like also to ask you about the future of this kind of therapy. But now that I have you, I know, and you have also written this in your notes for today, but can you maybe give us a introduction or maybe a brief overview of why this works? What is it that we actually are doing? And this might be a little bit over my head, but I'd like to give you at least the option just to to be a little nerdy here.
Yeah. I think this is really difficult to explain really well, but the way that we think it works, the immunotherapy increases the so-called regulatory T cells. These regulatory T cells are part of the immune response, and they are down-regulated in allergies. And these regulatory T cells are very important because they will induce the shift to the so-called Th1 response. In allergy patients, they have an overload of what we call the Th2 response. We want to make it more towards the Th1, which is the response that non-allergic people and animals have. And by having more Th1, we will decrease the amount of IgE, or allergen-specific IgE, that is produced. It's this IgE that we measure in the serology tests, and the IgE will bind to cells in the body like mast cells. And these mast cells, they contain these granules that make all the symptoms of the itch. So by down-regulating or decreasing the production of this allergen-specific IgE, we will have less pruritus. So this is basically very shortly what it does. And for the future, I think it's really interesting. I'm always at these European or in the world conferences, and they talk a lot about immunotherapy. And the last years there has been a lot of development in this field. There are new methods of application which are tested both for humans and for animals. What they do now is they start to treat the animals not subcutaneously by giving the injection under the skin, but by giving the injection into the lymph nodes. And this can reduce the number of injections that you need to give. In humans, they're now doing 3 intralymphatic injections into the lymph nodes at the back of your mouth. So it sounds really horrible, but they give 3 injections. And they have seen that after 3 injections, they can stop and they don't have to do anything for nearly a year. So this is really something very, very interesting, because by putting the allergen directly into the lymph node, we are actually getting it directly to where we want it to be, so that the lymphatic system can actually then work on this immediately. So this could also be an option, and there have been done studies also for this for animals. Then there are some new things out there. That's the use of recombinant or modified allergens, which is in the pipeline, and they're also using conjugations. So they are linking the allergens with other substances. There are 2 studies out there. One is with a product called Manan, and the other is with a product called Pulelan. And by binding the allergens to another substance, you can increase the effect. We're then talking about this kind of allergoids. And there are already some producers that produce immunotherapy for animals that use these allergoids. So that means that you can have less allergens in these bottles, and you have an increase in the effect, and you have to give less injections. And also there are interesting small studies out to do sublingual immunotherapy for dogs that are food allergic. And this is also something which is really interesting. So maybe we can, in the future, have some kind of drops that we can give the dog that is allergic to chicken, and after some weeks it will not react to chicken anymore. This could be really good, but because then the owners maybe don't have to stick to all these expensive diets for a while. Yeah.
So this actually concludes, or maybe we will have to round off now, because the time is up. I know that we missed some of the points in your notes, but I think that we got the general overview and got a good from A to C introduction to immunotherapy. And of course, there's a lot more to it than we can just talk about here for 45 minutes. But to round off here, can you please once again tell us where to contact you, and maybe where to go on the net, to the web, to learn more about this?
Yeah, if you want to contact us, you can go to www.dr.baddaky.com, which is dr.baddaky.com. And there you find the websites, Norwegian, German, or Danish. You can also go to the website, which is called www.nextmune.com. Nextmune is the global leader of veterinary allergy, and we are a member of that family. So nextmune.com, you will find also a lot of information about veterinary allergy and how to treat your patients. And on the Baddaky website, you can find an email address where you can also reach me if you have any questions. You're more than welcome.
And you talked that the Dr. Baddaky also have a service where we can get some help?
Yeah, sure. We have a telephone service every morning between 9 and 12 where the veterinarians can phone. And we have, on different days, we have either we have Scandinavian-speaking dermatologists, but we have some that are Swedish, we have people that are Danish, we have Norwegians, and we have people that can kind of talk Swash, which is a mixture of these languages. So we should be, we all talk English also, so we should be able to help you whichever country you are phoning from.
Yeah. And you mentioned one more site as well for owner reminders.
Yes, exactly. This is something that we have just launched. It's a web-based reminder system. So if you are a dog owner or if you have a clinic and you want to have help to the owner to get reminders about the injections, because we tend to forget this, you can go and log in onto www.allergi.vet. And there the owner can make their own profile, put their dog in, put in their telephone number, choose the correct immunotherapy treatment they have been prescribed by the vet. There are different options there. And then you will get a reminder. You put the first date of the first treatment, and then you will get reminders on your phone telling you when to give the next injection or when to put in the drops. And they will also remind you when it's probably time to contact your vet to get a refill.
Yeah. So a lot of good resources there. And of course, I will link to all of them in the show notes for this episode. So, Babette, thank you very much for your time and your very good introduction to this very complicated stuff.
Thank you very much, Søren, and I wish everybody good luck out there with their allergy patients. They are patients for life, so take good care of them.
Hvis du synes, det her med hudpatienter er en lille smule tungt, men alligevel er nået helt herhen til enden af podcasten, så må det være fordi, at du enten har lidt interesse for det, eller synes, at det er frustrerende. Og hvis du gerne vil lære lidt mere om de her hudpatienter, og sådan få en systematisk tilgang til dem, sådan at du kan komme i mål med dem, og jo komme videre med både de patienter, og komme videre med andre ting, du også skal, så har jeg et kursus over på hjemmesiden, som du kan få adgang til helt gratis i en hel måned som podcastlytter. Her i podcasten deler jeg nemlig en rabatkode, jeg ikke deler noget andet sted, og det er fordi, jeg har en særlig kærlighed til jer, der lytter med her i podcasten. Hvis du kigger over på hjemmesiden på SIVP.dk/4 uger, så kan du få gratis adgang til alle kurserne på hjemmesiden, og der er altså specifikt et om hududredning, der kan være interessant for dig, hvis det her emne interesserer dig, eller måske i virkeligheden, hvis det kun sådan interesserer dig perifert, og du ikke vil tage væk en hel dag fra klinikken for at blive rigtig meget klogere på det, men alligevel synes, at du mangler noget erfaring og mangler noget viden på det her felt, så er det her kursus en rigtig god mulighed. Helt gratis er det, som sagt, på SIVP.dk/4 uger. Der er også links og noter til dagens afsnit. De ligger på SIVP.dk/99. Næste søndag, der bliver det episode nummer 100, og der har jeg som sagt noget særligt planlagt, men lad os tage det på søndag. Vi høres ved. Hej.